Hello, and welcome back to Chat the Brain with Dr. Ghilain. I'm Dr. Christine Ghilain, board-certified clinical neuropsychologist. In today's video, I'm going to be discussing prematurity, as November is also Prematurity Awareness Month. So, without further ado, let's jump in. Okay, so as I mentioned, this month, November, is also Prematurity Awareness Month. As you've seen in my prior videos, I discuss epilepsy because November is Epilepsy Awareness Month. And I also discussed Alzheimer's, as November is Alzheimer's Awareness Month. So today, let's jump into prematurity. So what does it mean if someone is born premature? We think about prematurity as a child being born earlier than 37 weeks gestational age. So there are obviously different subcategories, as before 37 weeks leaves a lot of room for variability. We think about children born between 33 and 37 weeks as late preterm, between 29 and 33 weeks as being very preterm, and between 26 and 29 weeks being extremely preterm. Any child who is born prior to 26 weeks is considered a micropreme or micropremature. As you can see from the slide, there's also information about relative rates of survival in these children, though these rates are contingent upon being in a higher income country. I talked on my Facebook and Instagram account this week about some of the reasons that a mother might be at higher risk of having an infant born premature. On this list, you can see that there's actually quite a few additional possibilities that can contribute to the likelihood of an individual having a premature birth. Some of the things that are worth touching upon is maternal health, maternal age, any prior pregnancies, prenatal care, socioeconomic status, and obviously there are racial and ethnic differences as well. So before I dive into the reasons why an infant who is born premature might come see a neuropsychologist, I want to touch ever so briefly on some neuroanatomy that will be helpful to better understand what is happening in the brain when we're talking about some of the different outcomes of premature birth. As you can see on this picture, you see a slice of the brain. It is as if someone had taken a blade of some kind and cut straight down through the middle of the head. I want to orient you to the center where you see some holes. Those would be holes where there would be ventricles, and actually if you look closely, the lateral ventricles, which are somewhat in the center, are outlined and are noted on this particular infographic. This is just to say we're going to be talking a lot about areas that are around the ventricles. We know the ventricles are structures that house and circulate the cerebrospinal fluid around the brain, and we know cerebrospinal fluid is that which cushions the brain and keeps it safe within inside of our skull. The ventricles are going to be what we're going to be talking about, and I just want to note, based on this second infographic, that the ventricles are deep structures within the brain. There is an alphabet soup of different things that can occur if an infant is born premature. However, it is important to note that these do not always happen, and this is not a guaranteed outcome if a child is born premature. Nonetheless, if, God forbid, one of these things were to happen, these are reasons why a neuropsychologist is helpful. And we'll talk a little bit more about the role of a neuropsychologist in following these individuals over time in a few slides. So let's talk about some of the medical and neurological complications that can arise. One of the most common is an intraventricular hemorrhage, and that is a hemorrhage or a bleed within those ventricles, those blue structures that we just looked at a slide ago. There's often pressure in the vascular system or within the blood vessels, and it causes a rupture within this very delicate space. A periventricular hemorrhagic infarction, or a PVHI, is an infarction or an obstruction that occurs because of these high-grade hemorrhages, and when the rupture causes, it can cause necrosis or cell death of some of the white matter or brain tissue around the ventricles. This is called periventricular white matter. So periventricular leukomalacia, or PVL, is the result of that restricted blood flow and the injury that comes to the white matter that surrounds those ventricles. So as you can see, there's a lot that goes on very deep within the brain because these structures, if born premature, are not quite fully developed or are quite delicate at the time, and therefore they are more prone to, particularly the blood vessels, more prone to rupture or otherwise. And then there is hypoxic ischemic encephalopathy, or HIE, and this is really just brain change or brain disease that is caused by a reduced cerebral oxygenation and blood flow. So the blood flow to those parts of the brain is reduced, and when we have reduced blood flow, we have brain change or brain damage that occurs in those tissues. Some other things that also can occur for infants who are born premature include retinopathy of prematurity, or ROP. This is basically when the blood vessels in the eyes have not yet fully matured. They certainly can spontaneously recover, but unfortunately for those who have particularly strong complications, who are born particularly early, there's an increased risk that there can be long-term visual problems, visual disturbances, or possibilities of blindness. There's patent ductus arteriosus, or PDA. This is a heart condition where the ductus arteriosus, which is part of the heart, doesn't quite close, and it causes an abnormal movement of the blood through the heart chambers. Apnea of prematurity, or AOP, is unexplained stoppage of breathing. You think about sleep apnea in adults. This is something that occurs often in infants who are born premature. Lungs aren't necessarily fully developed, and therefore there is a stoppage of or cessation of breathing because their respiratory system is so immature. Oftentimes, again, this doesn't really last beyond the 40-week mark, 40 weeks gestation, but it's certainly something that infants who are in the NICU or are being cared for in a hospital are being monitored for. The final one I will talk about, though unfortunately there are quite a few more, is bronchopulmonary dysplasia, or BPD. That is the chronic lung disease that we see, or the long-term respiratory problems. So as you can see, there's quite a few reasons why there can be early brain change in an infant born premature, and a neuropsychologist is going to be best suited to assist these individuals in tracking their development and progress over time. So let's talk a little bit about the functional outcomes. They're highly variable. Where a bleed may or may not occur in these structures will change the outcomes in terms of functional limitations or things that are perhaps a bit more difficult for these individuals. Across the board, we do see some level of reduced speed of processing, visuospatial reasoning or visuospatial functioning, so that solving visual puzzles, continuing visual patterns, these can be a little bit more difficult for children who are born premature. That is a relatively common finding in these individuals. It also depends, as I mentioned just a bit ago, where specifically the damage occurs. So serial neuroimaging, we've talked about MRIs in previous videos. This is certainly a wonderful way to kind of get a sneak peek into what's going on inside the brain in terms of structure. Infants are often monitored using an EEG for seizure activity. There is cranial ultrasound that can be employed for monitoring these individuals, and there's also occasionally CT scans will be ordered. However, given the doses of radiation that are required, oftentimes this is somewhat of a last resort. But all of them can be used to detect neurological abnormalities. There is also higher rates of co-occurring diagnoses in children who are born premature. So they might be premature, but they also may have a diagnosis of cerebral palsy, which can affect motor systems, attention deficit hyperactivity disorder, which can impact attention and executive functioning, or learning disabilities. So for example, we talked a little bit how visuospatial functioning is oftentimes impacted in children who are born premature, and therefore things like math and applied visuospatial problem solving can be more difficult. However, it is important to note that even if some of these things do occur, it does not, again, mean that all of these outcomes are going to also occur. Neuropsychologists have excellent measures to track the progress of these children over time, even from infancy. These measures are sensitive enough to detect subtle weaknesses or subtle areas of difficulty so that intervention can be immediately initiated. oftentimes this can help to correct some of those trajectories to assist infants in living as normal of a life as possible. Early intervention, so that 0 to 3 time range, 0 to 3 years that is, does provide the best outcomes for children. So again, there's many ways that we can link families with early intervention strategies like speech, occupational therapy, physical therapy, feeding therapy. Certainly they may be involved in respiratory therapy, so there's many things that can be done to build skills early on, foundational skills from which a child can grow and mature. So I'm going to pop the references up on my screen as I usually do. I want to thank folks again for their willingness to tune in. As you can see, I've added my husband's podcast microphone. I've been given some great feedback that it has been somewhat helpful, but could be more helpful if I use a better microphone. So we've tried to work on some of that. And I just want to thank folks for tuning in, continuing to give me thoughts and feedback, and please feel free to let me know if there are videos you'd like to see in the coming weeks, because there will absolutely be videos posted. Thanks so much for tuning in, and I look forward to posting another video in the coming week.